The next seems to be a factual question. Will employers who do not pay a living wage be required to help pay for their employees' Medicaid?
Just to respond, to be eligible for Medicaid, you have to meet certain eligibility requirements, and those are now, they've been refined to be called Medicaid or adjusted gross income. Modified adjusted gross income will be the eligibility that drives Medicaid. If you're working, if you have more than 50 employees, the Affordable Care Act says you have to buy insurance for employees. Now that's been put off for a year, but that's the requirement. Even if they're paying you minimum wage, if you're one of those employees, and I think it's 30 hours a week, that was part of the Affordable Care Act, to get everybody insured. And I appreciate what Mike said about the cost of healthcare. And in my opinion, that's what really needs to happen. I'm just amazed at how difficult this first step has been. The first step is get everybody in the pool. Then start controlling the system of care. And I'm sorry, that brought up images last 2 presidential elections ago of death panels and things, but fundamentally, we are going to have to start talking about what is the value in the care we get. I think the consumer can make excellent choices. I think they need to have a supportive professional helping them who doesn't necessarily have an incentive to spend more. That's a problem. We have a system right now that rewards volume, not value. And that needs to change. And when I talk about system, I mean a system of care, not necessarily the insurance process. I think the insurance is the step so that we can move toward controlling costs.
I just wanted to add one more thing to that question for me. One other thing I'd like to see looked at is the federal poverty rate and how it's determined. Hawaii and Alaska have different federal poverty rates than the rest of the country, but I have a hard time when I look at some of those charts at what they have determined is poverty in this country. And we all know that what we can live on in Moscow, Idaho, is not what we can live on in New York City. And when they lump us all together, it's very frustrating to me to see a chart that shows that a family that makes $80,000 a year and has 6 children in Idaho is under the poverty level on the expanded rate. Because we have a lot of large families in Idaho. And so I would like us to be able to have a poverty level maybe by region or by state. And I know there's a lot of people that agree with me that look at some of these charts and just say, sorry, this isn't poverty. We live just fine. And for you to determine that all of a sudden that we're under the poverty level, not only to many is offensive, but there's a lot of people who don't think people who make that wage should be given any subsidies.